very much for those kind remarks, and thank you for ILSI Canada and US for inviting me to speak at this meeting. I want to start while you're looking, I guess, at that slide. I'm not sure I like the term new alternatives. I like the term alternative methods, and I'm going to explain that. I'm going to show you probably the oldest alternative method that's out there. It's never been validated, but it's accepted by every government agency around the world. And if you know what I'm talking about, just keep it to yourself until we get to that. I want to take you back to 2007 when this particular document came out of the National Academy of Sciences in 2007. And it was a conglomeration of scientists, including toxicologists, drug people, safety people, regulatory people, and they were really focusing on environmental agents, but I think it applies to all of the agents. This is really where it all started. And the strategy that they developed was to move us away from animal testing to human testing. And basically, you see option one at the time, animals, high dose, low throughput, expensive, time consuming, relatively large number of animals, and ethical endpoints. To move us over to the red side, where we're going to be in vitro, using human tissues. It's going to be faster, less expensive, virtually no animals, perturbation of toxic pathways. But when you think about, is it really less expensive when you start putting these multiple endpoints together to get the same answer? And is it any shorter in time? Virtually perturbation of toxic pathways, we're beginning to see some of that. I would suggest to you that we're really not anywhere near virtually no animals. If you think about the genetic modifications that we can now do in animals to make them with human diseases, and I've listed some of those diseases, we're increasing actually the number of animals that we use in overall toxicology and biomedical research. And you notice the homology between the mouse and the human gene is pretty good. And 99% of the mouse genes have a 1-to-1 homology in the human gene. So there's really a lot that can be learned still from animals. And I would suggest to you that we're maybe not as close to that no animal use as we hope we would be. Well, when we think about animals, who's got the model? What's the model we're going to use? Well, I'm just going to list for you bunches of models that people have come up with. And there are all kinds of models that are out there. Probably the one in vogue right now is the zebrafish, and the worm is also being there. Now, Christy stole my next slide because we had the model in 1883. There's Harvey Wiley right there, who came in to head up the FDA program, and he had his hygiene table. We had the model. But unfortunately, what he was doing was taking these, I think she said, strong young men, and feeding them on Monday, 1x the amount of the chemical, Tuesday, 2x, Wednesday, 3x, Thursday, 4x. And if they were okay on Friday, that additive was approved. And that was done with borax. Classic. I mean, this is true. This actually happened in the basement of the old FDA building. But we can't do that, so we're back looking for alternatives to animal experiments. We've gone through in vitro, tissue cultures, and silicone, and we've got all kinds of potentials there. Well, where we're really getting to now, and the focus seems to be something on a chip. I mean, if it's not on a chip, it's not very good anymore. And so we're getting all kinds of things. We're moving away from 2D, 3D to the organ on the chip. And I think the future is, are we going to be able to put a man or a woman onto a chip? Right now, one of the biggest issues we have in chip technology is the kidney, because it's got a bunch of different tissues and they have different functions. And so we have to be concerned about the multiple renal components. It's not like the liver where primarily it's one tissue that we're looking at. It's got multiple tissues, and the nephrons have a bunch of different functions. And how are we going to replicate those? So that's the one that's going to be the tough one, but it'll come with time. There are limitations. Tissues should be readily available, but guess what? We have tariffs now. And it may be hard to get those tissues into the country. So that may be a problem because a lot of these tissues are produced outside of the US. They tend to be pretty expensive. There are not very many manufacturers. They differ slightly among manufacturers, and they're still relatively simple models that do not support the whole body. And this might impact our toxicity predictions. And again, just as with whole animals, we need to be careful how we interpret the data that we get out of any of our studies. Computer-aided drug design, and here is where the alternatives have really been effective in drug design because they know the endpoint they're working with. It may be the liver, it may be the kidney, it may be the heart, but if you know the tissue of concern, of issue, which unfortunately the food people don't always know, whether it's going to be the liver, the brain, the kidney that's going to be affected. But in the drug area, we can use computer-aided design to help us understand binding and ligand interaction between molecular design of the molecules we're making. And then this allows us to avoid testing of unwanted chemicals having no biological activity. Categories of software, there are all kinds of models out there. My last recollection, Susie, FDA had 8 or 10 of these models that were available that people could go online and use. There are all kinds of binding site prediction and docking, ADMA, toxicity models that are out there that you can use. There are advantages and disadvantages. Prediction of designed compound before synthesis of novel analogs is really an important thing in the drug industry and a very advantage to these approaches. And I've listed some of the disadvantages. If we know what the mechanism is and what the organ is, it's relatively easy to develop alternative methods. In the case of cardiovascular toxicity, we have got all kinds of alternative methods that we can use to understand the mechanism that's going on in the case of a toxic material that's affecting the heart. But if we don't know the heart is our endpoint, these methods are not going to do us any good. So we need to know what that endpoint is, and I've listed a bunch of the various types of endpoints that are available to us. You guys mad at me? Okay, some of the issues we need to think about when we begin to think about alternatives. And I've listed just a few of those issues for us to think about. Metabolism. If we don't have the primary organ responsible for metabolism in our in vitro complex, we don't have metabolism to the same extent that we would in a whole animal system. Just as all of a sudden we begin to think about the microbiome. Has all the animal work we've been doing over these years been altered by what's going on in the gut, the microbiome, or the skin work we're doing for the microbiome that's on the skin? These are issues that we've got to think about as we begin to develop these new alternative methods. N equals 1, typically when it's on a chip, it's coming from one person, one individual. We need to think about that. Polymorphisms, there are about 1.42 million single nucleotide polymorphisms, and 60,000 of those fall within the coding region of the gene. That's diversity in the population. And what do we use, Christy? 10x to take into that. in our safety factor. So are we thinking even broadly enough with our whole animal studies when we think about these kind of things? I'll get rid of non-human because all of our chips are on humans, but that brings back the immune system, which is, it's which immune system? The gut immune system or the inactive or the innate or the active immune system? Which cells are we talking about? And in the case of N equals 1, we're starting to get multiple livers that are from different sources, different individuals, but we still got to be concerned about the polymorphisms. For those of you that aren't familiar with polymorphisms, the definition is a genetic variation in at least 1% of the population, your blood types, major histocompatibility. Many of the phase 1 and phase 2 metabolizing enzymes are polymorphic driven. Sickle cell anemia. I'm going to give you 2 examples of these polymorphisms. And the reason we set it at 1% is so that we don't run into the intermarriage, and it's in a very small population, such as in Queen Victoria's family, where they ended up a bunch of them being hemophiliacs because they intermarried over a course of time. So it's that 1% cutoff. When we're thinking about, here's a classic example, aldehyde dehydrogenase. I think there's going to be a social this evening. Is that correct? Yeah. And they might have some spirits at that gathering. And this is the way alcohol is broken down through this pathway that's right here. This is the way we break down alcohol. And typically in the Western society, we're all homogeneous for the wild type. But when you get into Asian populations, up to 40% are heterogeneous and about 5% are homogeneous for the recessive type. So this gives them what's known as the Asian flush. Is there anybody of Asian descent in here? Yes, I think I see somebody that might be of Asian descent. Do you flush if you have a couple of drinks? And that's just, that's a polymorphism that's there in a very significant part of the Asian population. The other one is PKU. About 1 in 10,000 babies born in the US are PKU. So that means that they have problem with aspartame, and it's the phenylalanine that's the issue. Under normal circumstances, it's broken down into tyrosine, and then that's used in typical amino acid or protein rebuilding. In the case of the PKU patients, the issue is they simply don't have that enzyme, and they're not able to break it down. And so they get a buildup of phenylalanine, and you have the health problems that occur as a result of that. We do have some success stories. And there have been some really good success stories in the area of developing alternative methods. Genotoxicity, the EPA 6-pack. If you're not familiar with that, that's the acute oral, dermal, and inhalation, and the sensitization and irritation. Sensitization, botulinum toxin. I'm sure that none of you ladies in here would even consider using Botox, which is botulinum toxin. My son is a dermatologist, and he tells me that about 10 to 12% of his patients now that are using Botox are men. So I guess vanity is moving into the male species 1 minute, and I will just show you that first test right there, the Ames test, never been validated. It's an old alternative method, and it's used and accepted all over the world. Acute toxicity test, you can see these here. The thing that I want to point out on all of these next ones is simply the reason we were able to develop these tests is because we understood the mechanism or mode of action. In the case of sensitization, we know exactly what's going on. so we could build that test. In the case of botulinum toxin, we know exactly mechanistically what's happening. The mouse lymphoma test, about 600,000 mice were killed annually for developing Botox, and Allergan spent about 65 million to develop their test. There are a couple of other tests that are out there that can be looked at as well. Pyrogen was developed a long time ago and has been used, and it was officially the microsite activation test in 2010. But I want to point out to you the estimate in 2015 that they were still using something like 400,000 rabbits around the world, even though we had an alternative, validated, accepted method, at least in the United States. So the issues really are these more long-term tests that have been pointed out. And I'll just briefly run through this. This is Ray Tice after that 2007 National Academy of Science report came out, pointing out some of the issues that occurred at that time. And those issues are still pretty valid today. Probably the most important of these is it an effect that is just a normal biological effect that's going to be overcome, or is it an actual toxic effect that's there? And then we've got the microbiome and metabolism. Thank you very much for your time. Sorry I sped up at the last.